Will the £500 million bailout for the NHS, which Labour are calling for, make any difference?
This was at the Labour Party conference, £500 million for the NHS for this winter. Will it make any difference? Karen Bradley?
Well,
you're not calling for it.
Well, we've given the NHS the money that they asked for. We have made sure that they have the funding they need, and I know the Health Secretary is working hard on contingencies for this winter. But it's not just about money, it's about how we run the NHS, it's about how it's configured, it's about delivering services, and it's about being ready for winter crisis when they arrive. I'm not sure that it's necessarily just that whatever money is promised by the Labour Party is necessarily going to be enough.
What do you think?
I really don't think it is going to be enough. It'll just be a little bit of a sticking plaster on the wider issue. It needs billions and billions of pounds spent on it, and even the Conservatives aren't really putting enough money in, as far as I can see.
But we've put the money in the NHS asked for.
Yes, but we don't feel that that's enough on the ground. I'm a GP in the NHS in Wolverhampton right now, and we've only just really got through the summer period. I really have a great fear that there's going to be a massive winter crisis like we've never seen this winter throughout the country, and people are going to be unwell. There's going to be frail elderly people that can't get any community care, any social care to keep them in their own home, so they can be looked after there. They're going to end up in hospital where they shouldn't be, and they're going to end up with many more problems than they started with, and this is going to happen this winter, and I don't think there's going to be enough money to cover what's happening. So they put money in last winter. The Conservatives, sorry, you put money in last winter, but really we didn't see anything on the ground. Nothing really changed.
This is a Labour proposal made by Labour's Shadow Health Secretary.
It is.
Are you saying to Ian Lavery that it's not enough, that it's just a...
I don't quite know why they came up with that figure, to be honest
with you. Well, we'll find out from him.
But can I be clear?
Hang on a second. I'll come back to you. Why did you come up with this figure? She's a GP working in Wolverhampton. There's nowhere near enough.
Obviously doing a fantastic job, by the way.
That's not the point, is it?
And last year, during the winter crisis, there was 10,000 individuals waited more than 4 hours a day for treatment in A&E, and we believe that the crisis, I agree with what you're saying, the crisis, impending crisis this winter could be worse than that. I mean, it was unbelievably bad in those hospitals, and isn't it fantastic that we've got these great doctors and nurses who, despite the fact that they've had their wages hammered, are that committed and dedicated to the NHS.
Can what she's saying is that...
without 500
that's
million...
not the point of the question. The point of the question is not that. The point of the question is whether you are just making shadow boxing by offering this amount of money, because it's not enough to do anything effective.
It's very insulting saying that we're shadow boxing. It really is insulting. We're saying that there should be £500 million. We believe that should be put in place, and we're calling on the government to put the £500 million in place to try and prevent and help the NHS through what could be one of the worst crises we've faced in any winter for many years. I hope that it will be enough. I'll tell you one thing, the Tories will not be putting any money in to help the NHS, so we shouldn't be criticised when we say that we're going to put money into the NHS.
Ian, you always come up with another number and another number and another number. There needs to be reform. The GP who talked about social care, and that's where we need to work. That's why we put an extra £2 billion into social care. We need to make sure we've got the facilities on the ground. It's not an easy solution. You know, just throwing money at the problem is not the easy solution. This is far more complicated than that, and that's why we've got to work to reform the whole health and social care system so that it's more integrated and you have the services you need.
Some very damaging reforms, though, hasn't there, at the start of the Tory government that started with when they came into power. So I'm really not keen on any more large-scale reform, because I think that does actually waste money as well.
Integration of health and social care.
Yes, that would be good. That would be good. That would be a good start.
I'm correct that the figure is 0.5%, isn't it, increase on the total budget for the NHS, which is over 100 billion.
125 billion.
Yeah.
Anyway, it's not a large number in proportion, but the woman there in the third in, yes.
I'm an advanced nurse practitioner and I work in an urgent care centre, and we are inundated. Every shift is busy to a ridiculous degree, and this has been over the summer months. I'm dreading the winter months, but we get people who come and sit there for 4 hours or more if they have to, because they can't get appointments with a GP. And they come to us because there isn't enough availability for GPs in the community. There isn't the funding to support the community care, and so they come to us. So we are absolutely stoved out with people that shouldn't be there.
Do some GPs send people to you because they haven't got the time and place to see them, numbers to see them?
They do, but obviously the out of hours, they come to us because we are there. But yes, they do send them to us because they can't see them, but that's because they are very busy too. It's an absolute vicious circle.
You, sir, with the spectacles on there, on the gangway. Yes, and then I come to you over here. Yeah.
Yeah, this term, winter crisis, if we go back in time to when we had a Labour government, I don't remember that term ever showing up. It's something that in the last few years, every year someone says winter crisis, winter crisis. Well, the only reason we're having that is because this funding has been misused. You're putting money there, but who's the money going to? How are things being managed? It's just not working. Okay. It hasn't been working for years.
The woman there